Welcome to the Darcy Wellness Series. During our series, we will present information on complementary and alternative medicine and how non-drug and non-surgical options can benefit your wellness and the health of your loved ones. Today we're going to talk about chiropractic. What is chiropractic and why does it help chronic pain? And really, if you or your loved one has any neck or back pain, really should listen to this show. It could save you a lot of suffering. My name is Geoff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic. And with me in the studio is Dr. Pheng Kouch, a chiropractic physician, also practicing at the Darcy Wellness Clinic. Welcome, Pheng.
Thank you.
So we'd like to talk about today, chiropractic. What is chiropractic?
Chiropractic is really an art form. It's putting motion into a joint when there is little or none. The best way to explain chiropractic really is with an example. When areas of the spine aren't moving well due to trauma or repetitive injury, muscles in the area tend to spasm. That resultant spasm is very painful.
Yep.
When you have that spasm, other areas in the spine compensate because you still have to move around.
Yeah.
What happens is other areas of the spine above the area of spasm or to the opposite side of spasm tend to overcompensate. And that's fine for a while, but after years of overcompensation, the other side tends to become injured as well. What we do as chiropractors is to really get into those joints, and with what we call an adjustment, we facilitate motion in that joint. Mm-hmm. And when we do that, the muscles in that area tend to release and tend to relax for us. Right. And we improve that motion in that spine.
So for instance, the other day you gave me an adjustment. I was tight in one area, you adjusted one part of the spine, it released and took the discomfort away from another part of the spine.
Absolutely. We worked on your low back and we tried to, you had a lot of tightness in this mid-thoracic spine. Yep. We worked on that low back to try to relieve that pressure. Then we also went in and adjusted that middle of the back too, just to increase the motion and the flexibility in that entire spine of yours.
So what is chiropractic good for?
A number of things. Musculoskeletal complaints is what we do. That's our bread and butter.
So like neck pain, back pain,
exactly.
Sciatic pain down the legs.
Any of those types of pains, neck pains in particular, back pain, low back pain in particular. We're really good with that. We also deal a lot with extremities too. Not all chiropractors work on extremities. I tend to really enjoy working on extremities. Shoulders, knees, ankles.
So the wrists.
The wrists, absolutely. Carpal tunnel, TMJs.
So if there are bones and they're out of alignment, no matter where they are in the body, chiropractic could potentially help that.
Exactly. I mean, there are limits to what chiropractic can do.
Yeah.
If a joint is completely ruined from, say, trauma, there's only so much you can do, and you can help most people. You might not necessarily be able to return them to 100% function, but in most cases...
it's not a panacea for all chronic pain. I actually came across a study the other day, a Canadian study, and they had everybody who was a surgical candidate, before they went through the surgery, tried acupuncture, and then they tried chiropractic, and the results were that 1/3 of the people responded to acupuncture, didn't need the surgery. 1/3 responded to chiropractic, didn't need the surgery, and 1/3 actually went into surgery. Absolutely. So it's not a panacea for all chronic pain, but it can be a big help.
Definitely not a panacea, you're right. But in terms of low back pain with pain radiation past the knees, we're able to help about half of those people and prevent half of those people from needing to go into surgery.
So this is a tremendous option for somebody who might be using non-steroidal anti-inflammatories, Tylenol or ibuprofen continuously, or facing a surgical option rather than... So it's a non-drug, non-surgical way of trying to relieve pain.
Right. With the non-steroidal anti-inflammatories, there are so many complications associated with that, as you well know, but our viewers may not know. Upwards of 17,000 people a year die from stomach-related problems directly related to non-steroidal anti-inflammatories.
So the idea of they wear away the intestinal bacteria and the stomach bacteria, and that leads to bleeding out or some problem. So that's in chronic use, and it's often in the elderly. But what your profession is a way of trying to get to a degree of health without having to need non-steroidal and without having to use surgical options.
Exactly. You know, we definitely want to wean patients off of non-steroidal anti-inflammatories, especially if they're taking them every single day, like many people do in the United States. You know, pop in 4 or 8 tablets a day just to get by the day.
That's right.
And
maybe it'd be a good time to go to one of our slides that we've prepared for everybody out there. So basically we can see from this one that the back is a very complex mixture of bones and ligaments inserting to muscles, and you pull one, it can torque out the other.
Absolutely.
And if we could go to our other slide. So how many chiropractic visits are there a year?
About 20 million or so.
Yeah. That's 20 million Americans.
20 million
Americans
utilizing chiropractic.
So a lot of people think that once they start chiropractic that they have to go on for forever, right?
You know, it's not necessarily like that. It's patients enjoy the feeling they get when they get treated.
Yeah.
And if you feel well after you get treated, why wouldn't you want to go back?
Exactly. So for instance, you know, you gave me an adjustment. I had a long day, kind of hunching over doing acupuncture in our clinic. And at the end of the day, I had a quick adjustment from you, and I walked out feeling energized.
Exactly.
So
why wouldn't
like
you want?
that.
Why
exactly.
wouldn't you want to feel
so
like that?
So it's keeping the structure and the nerves then in good health.
Right. Absolutely.
So you can treat a lot of nervous problems, you know, nerve-related problems.
The spine has nerves that exit from it. These spinal nerves go to everywhere in your body.
Yep.
And every time
those little yellow things coming out of our friend here.
Exactly. These
They're
little yellow
nerves
things
that kind of come out and wrap themselves around the body.
Right. The upper nerves go to the arms and hands.
So the difference, me being able to breathe easier after the adjustment was because of the cervical, because of the thoracic nerves wrapping around in through the lungs.
Well, that, and also we're opening up that rib cage when we adjust that thoracic spine.
Yeah.
And you know, the ribs come around and articulate kind of this way here.
Yeah.
And there's a joint right here, and as we make that adjustment on you, we open up those costovertebral joints.
Right.
And really get your muscle, the rib cage opening up when you breathe.
So, you know, pain is a huge problem in our society. I read a figure that there was 70 million people suffering from chronic pain. So this is a huge option to try first before you go on to anti-inflammatories, before you go on to surgery.
Sure, absolutely. You know, most people will try the anti-inflammatories first and all these other things, and that's fine, you know, but what we want to do is to not have them rely on anti-inflammatories in the long term. During acute pain, you know, it is helpful.
So do the adjustments hurt? I mean, the big thing is you hear a noise and most people think it's pretty scary.
Right.
But do they hurt?
No. Well, it kind of depends.
Yeah.
If you come in pretty acute and there's a lot of tight muscles and the muscles are spasmodic, when you do the adjustment, it's not going to be particularly comfortable per se.
But it's a very short period of time.
Exactly. It's a very brief...
And oftentimes afterwards there's relief.
There's instantaneous relief.
Yeah.
Instantaneous relief. And that's one of the great things about chiropractic is that it really is that instantaneous...
maybe we could go to our other slide that we have. So on the screen right now we've got there's a hand on the right and a hand on the left showing decreased space between those joints, and the aging process as we age, or if we take knocks, the joints start to, the space between them decreases.
Exactly. With normal wear and tear, and as you age, joint spaces tend to decrease from use.
Yeah.
And the idea is that we want to increase the motion in those joints as long as possible, so they don't become disused and atrophied. Right. The muscles around them atrophy and
so it's not that you can make the arthritic joint go away, but you can just bring them into better harmony with each other and create an environment where there's less inflammation.
Right.
Yeah.
Right. You know, as we were speaking about before, where other joints in the area have to compensate.
Yep.
If you have an area in your hand that isn't compensating, that isn't moving quite well, you put increased pressure on other parts of
right.
that hand
right.
to have to overcompensate, to compensate
yep.
for the motion that's lacking in one part of the hand.
Right. So we actually have a video of you giving an adjustment and somebody explaining that, you know, how much relief they got. I think now would be a good time to see George and the relief he got from your adjustments.
That'd be great.
So we'll go to the video.
Hi, my name is George. I'm from George's Pizza in Eric, and I had some problems with my lower back. Visit my regular practitioner, x-rays, you name it, no cure, painkillers. So I ran about 8 months ago. I ran to Dr. Pheng, and he's a chiropractor, and we did some adjustments, and I feel very good.
Yeah. Well, George had a lot of problems in his low back and in his upper back as well.
Mm-hmm.
A lot of muscular issues with the work that he does. He stands on his feet all day long and constantly, you know, moving here, carrying this, carrying that. And there's definitely a lot of problems up here and all along the rhomboid region and the scapular region. And we're able to address that with the chiropractic adjustment and help him out quite a bit, I believe.
Oh yeah, absolutely, yeah. Absolutely. Have you had any problems since June?
Yeah.
Oh yeah, 2006. Yeah, very good.
Fantastic. You know, we're gonna show an adjustment.
Sure. Yeah.
What we're gonna do now is called an anterior thoracic adjustment. What I'm going to do is I'm gonna have him cross his arms. I'm gonna put my hand underneath his back. Have him take a nice big breath for me. And the adjustment looks a little bit like that. What we're doing is we're opening up the joints and getting motion back into the joints and, yeah, relaxing the muscles in that region. Go ahead and sit up for me, George. Go ahead and swing your legs that way. Just going to check his neck. And what I want you to do, George, is to come on your side, face me. I'm going to do the side posture adjustment right now. Again, I stabilize his leg, push here. Take a nice big breath for me, George. Put my hand on his low back, roll him over, and then drop. And then we're going to do the other side. Nice big breath for me, George. Good, just relax. Good. George is a big guy, so it's a little difficult to adjust him, but we manage, and George has been doing very well with the care so far.
Very, very good.
So, really pleased about that.
Very good.
Great.
Well, welcome back. That was a great endorsement, really, of chiropractic and the work that you do. And really, you know, I myself have been in a great deal of pain, and one or two adjustments, the pain has gone away. So it's a tremendous tool. How long has chiropractic been around and been developed as a science and an art?
Chiropractic, as a profession, has only been around for about 100 years.
Yeah.
In that 100 years, we made tremendous strides. You know, back in the day, chiropractors actually used to be jailed for practicing medicine without a license,
yeah.
So they were claimed. And there's always been that rift between medical doctors and chiropractors.
But some medical doctors refer into into Darcy Wellness Clinic for acupuncture, but also for chiropractic. So it's becoming more accepted as time goes on.
Absolutely. Medical doctors, the newer ones especially,
yeah.
are really realizing the benefits that chiropractic can make with their patients, and
yep.
and a number of them really are referring to chiropractors for care.
So if we could go to our next slide that we have prepared. So we can see you doing an adjustment here. So basically, maybe you could just describe a little bit about what you're doing. It looks like a wrestling hold, but really it's not anymore. Right?
Sure, it really does kind of look like that.
So it's just a gentle pressing in opposite directions here that you're doing on these adjustments?
With the adjustment, the first slide that we showed was a low back adjustment.
Yeah.
Right now, we're just palpating and doing kind of motion checks of the spine.
Yeah, and what kind of conditions do you treat successfully?
Chiropractic is tremendous with relieving low back pain.
Yeah, so low back pain would be the number one. If anybody's suffering from lower back pain, they really should seek out a good chiropractor.
Absolutely.
Yeah,
absolutely. That's.
But we're biased though. But generally speaking, so low back pain is the number one.
Low back pain is definitely up there, number one. Neck pain.
Neck pain, yeah.
Follows there. Headaches.
So with neck pain, if you get the cervical vertebra in alignment, would that affect the nerves into the head and migraines and headaches?
Absolutely. Well, it's a little bit more complicated than that. It has to do with certain muscles in the back of the neck that attach to the outside covering of the brain, the dura mater. And when we perform chiropractic adjustments on the cervical spine, we relieve that tension of the muscle called the rectus capitis posterior minor.
Can you say that again?
The rectus capitis posterior minor.
Yeah.
And we really release the pressure on that, and there's a lot less pull on that dura mater, and has been really great in diminishing headaches that come from the neck.
Yeah.
In terms of migraine headaches, true migraine headaches, some studies have shown that we're just as effective as the leading pharmacological intervention, and without the side effects. Exactly. So why wouldn't you want to try something like chiropractic
and
first?
I know that I've referred out a lot of my patients, at the Darcy Wellness Clinic, that we refer to each other, but we've treated some patients for headaches, working on the cervical alignment as well as acupuncture to stop the headache.
Yeah, and the combination at the clinic does a great job with patients.
So maybe we could go to our next slide. And on this slide, it's difficult to tell, but the one on the right is the unhealthy X-ray, right, where the joints are really lost their cushioning, and on the left is the healthy X-ray.
Right.
So this is an X-ray of what?
This is an X-ray of a lumbar spine.
Lumbar spine.
And what you'll see is that...
so where you don't want to be is on the right.
You don't want to be on the right, definitely. You can tell that the joint space on the right is definitely decreased about a quarter of the size of the disc space on the left. What you'll also notice is that there's a lot of extra white around the joint. And what that is, it's the body trying to protect itself. It understands that it's damaged in that area.
So what's it protecting itself with?
It's protecting itself with bone, with increased bone.
So it's increasing calcium deposits in the area.
Exactly, at those end plates, to try to buttress those joints as much as possible.
Right. So then, in general, if you were to see a spine like that, what would you start to do?
Well, we would definitely try to increase the motion in those vertebral segments.
Right. So very gently, it's not uncomfortable, you're opening up those areas.
Exactly.
Are they doing anything in between, or are you having them
during the initial acute phase, if a patient comes in quite a bit,
they're in a lot of pain.
Exactly, in quite a bit of discomfort. We'll have them ice pretty much.
Yeah.
We don't want them to do any stretching
quite
yet.
So that's more in the maintenance phase once they're out of inflammation and out of pain.
Exactly, that will come down the line. But initially, when a patient comes in acute, we definitely
So you help them out of the acute phase. What happens when they get to maintenance? What do you do to help them in the maintenance phase?
During the maintenance phase, when patients come in, we'll see them. Maintenance for different patients means different things. If you're in heavy construction, you're working on your feet all day, maintenance for you might be once every 2 weeks. For another patient who's an athlete and in great, tremendous shape, maintenance might be every 6 weeks. So it really depends on the patient themselves, on what the duration of maintenance is.
And if they're going back out and causing some strain or sprain and redoing it again.
And what we're really doing is we're making sure that the motion is is in that joint, in the fixated joints.
Yeah.
And, we want to keep all the segments moving equally so that no one segment is compensating for another segment and becoming injured.
Right. So let's talk about the elephant in the room. You often hear that, chiropractic is dangerous. Some of the criticism that commonly heard are, don't let anybody do an adjustment on your neck. It could cause a stroke.
Sure.
I mean, you'd have to be, elderly and in very poor health, and no chiropractor in his right mind would be doing an aggressive adjustment on a neck like that.
Well, there definitely have been reported cases of stroke with chiropractic. There's
like
also
1 in 3 million. I have the figure right here.
1 in 3 million. And as with what you said, these patients are, if we suspect a patient might have some cervical problems, some cervical vascular problems that might lead to a stroke, we perform very, very gentle manipulations on their neck. We're as gentle as we can be in the first place.
So it's true to say then, I read that chiropractors have some of the lowest malpractice in the medical profession.
Absolutely.
So that must reflect risk, because it's such a litigious society that if your malpractice is so low, it must ergo that it's
just hit it right
the
on
safest.
The head. Hit it right on the head.
Maybe we could go to our next slide. So tell us about what does it take to become a doctor of chiropractic?
Quite a bit of education. There's 2 to 4 years of undergraduate study. Most people in chiropractic school do have a 4-year degree. And at chiropractic school, it's another 4-year program of quite intense training.
So it's you've felt very prepared coming out into practice, when you started.
Absolutely.
Yeah, so it's a good training. And so the safety issue then is pretty much handled. There's absolutely no problem there. Tell us about the next patient we're going to be seeing. We're going to be seeing, I believe, Audemars now. Can you tell us a little bit about what was happening for him when you first saw him?
Sure. Audemars came in with tremendous neck pain. With a combination at the Darcy Clinic with Geoff and I, with the acupuncture and the chiropractic, and also some massage, we were able to get him out of discomfort quite quickly. In I think 3 or 4 visits, we were able to get him out of the majority.
That's right. And
of
considering
his
he was since the original injury, he was in extreme pain for like 4 or 5 years with his ankle, and many years with his cervical shoulder tightness and pain that he had.
Audemars has responded really well to the chiropractic care and to the acupuncture.
Maybe we could take the time now to just go and visit with Audemars at the Darcy Wellness Clinic.
Hi, my name is Audemars. I came in here about a month ago with a lot of back pain, neck pain, having problems sleeping, and started treatment with Dr. Pheng, as well as acupuncture and massage therapy here. And I feel so much better than when I first came in, and really Western medicine has always let me down, and Eastern medicine has provided me comfort and relief.
Well, Audemars came in with a lot of upper back and neck problems, a lot of muscular spasms in the neck, and a lot of squinching of the joints in the neck, in these posterior joints back here. What we've been able to do is restore a lot of the motion back in his neck, giving him a lot more range of motion and decreasing a lot of the symptoms of his pain. In his upper back, similarly, a lot of muscular spasms again, and with the chiropractic adjustment, we've been able to help him out quite a bit, I think. We're going to go ahead and show what we do for Audemars. Go ahead and lie face down for me, Audemars. Face up, rather, I'm sorry.
Face up?
Yep. I'm going to do that upper thoracic adjustment for me. Right there. There you go. What we're going to do for Audemars is an upper thoracic adjustment. I'm going to have him give himself a big hug. I'm going to take my hand, put it on the upper portion of his back, Have him take a nice big breath in. Good. Tuck your chin. Good. And relax. Excellent. And that was the upper thoracic adjustment. From here we move to the cervical adjustment, the neck adjustment. Neck is feeling pretty good today, which is great. A little bit of restrictions. What we do is we just take a contact on the neck, kind of rotate his neck over my hand, and deliver a quick short thrust called an adjustment. Go ahead and sit up for me, Audemars. Swing your legs that way. What we also do with Audemars is we do some muscle work on his neck to try to stretch the tight muscles in his neck. And what we do is a process called myofascial release technique, where we take the muscle from a contracted state like such, put pressure on the muscle, and then move his neck in a specific range of motion to use that muscle. And this works particularly well with Audemars, and he's received quite good results with this. Good. Very good. Good. And yeah.
Feel better already.
Thanks for joining us today on our series on wellness. We hope that you've learned some new drug-free and surgery-free options and for becoming pain-free and achieving your health and wellness. From myself, Geoff Darcy, and Dr. Pheng Kouch, a chiropractor physician at the Darcy Wellness Clinic, we wish you and your loved ones health and wellness.